Welcome to Connecticut's Health Report. Episode 6, What's on Public Health's Radar? With Connecticut Department of Public Health Commissioner, Dr. Manisha Jitani. Because being informed is the first step to being protected.
Good health doesn't just happen, it's built. The last time you buckled your seatbelt, did you think about it before you did it? Or turned on the tap and drank the water without a second thought? Or got a vaccine that protected not just you, but everyone around you? None of that happened by accident. Someone fought for it, proved it worked, and put data to action. Welcome to Connecticut's Health Report. I'm your host, Brittany Schaefer, and I'm joined by Department of Public Health Commissioner Dr. Manisha Jitani and East Hartford Department of Health and Human Services Director Lawrence Burnset. Thank you both so much for joining us today.
Glad to be here.
Yep.
So today we have a lot of ground to cover because right now there's a lot happening in the world of infectious diseases that Connecticut residents deserve to understand. We're talking Ebola and why a new outbreak thousands of miles away still matters here in Connecticut. We'll cover H5N1 bird flu, which continues to evolve and spread in ways that have public health officials watching closely. We'll dig into the risks hiding in raw milk and unpasteurized dairy products. And as summer kicks off, families heading to fairs, farms, and petting zoos. We'll talk about the pathogens that can come along for the ride. So right now, there's an Ebola outbreak in the Democratic Republic of Congo involving a strain with no approved vaccine. The World Health Organization has declared it a public health emergency of international concern. And understandably, Connecticut is asking questions. So my first, Commissioner, is it a concern here in Connecticut?
The top headline is that the risk to residents in Connecticut is low. But what is most important for people to know is that we are monitoring the situation very, very closely, working with federal and international colleagues to understand what the state of affairs is in the DRC. And what we know right now is that testing is improving. Therefore, counts of patients that have Ebola there are improving. Mm-hmm. The more we have knowledge of what is going on there, the more we can be informed of what risk is posed to the Connecticut population. Right now, all patients that are coming back to the United States, the only ones who are being allowed to come back are U.S. citizens. All residents that are coming back to the U.S. who are U.S. citizens are coming through 4 airports. One in Houston, Texas, one in Atlanta, one is Dulles in Virginia, and JFK in New York. And the only residents that are allowed to come back have low risk to begin with, which means that they really did not have any contact with somebody who had Ebola. The thing to also recognize is that Ebola is a disease that you are not contagious until you're symptomatic. And the symptoms initially are dry symptoms. They can reflect many different infections, things like body aches, fevers, chills. When you have wet symptoms, things like vomiting, and the thing that is most concerning is bleeding. And you need to have direct contact with those secretions with your own mucous membranes. So it is pretty close contact, but it is extremely infectious once you do have those symptoms. So when we do have a low-risk person who comes back, who has not had contact with somebody like that, but maybe has been in the region, we then notify our local health departments. And that is what's most important, because for people in Connecticut, what you need to know is only low-risk people are coming back, and we are working closely with local partners who are the boots on the ground, doing monitoring with people who could have potentially been impacted.
So I think the sentiment here in Connecticut is really just to be informed, not alarmed at this point.
Absolutely.
And it's great to see that at the state and local level that there is a lot of preparation underway to keep residents safe. So how is Connecticut equipped to respond? And then I'll ask you, Director Burnset, how are local health departments equipped to respond?
So I think the first thing to know is that we have testing capacity at our lab. We are working with all our hospitals in the area. Hospitals are preparing in the event that they have an Ebola patient that comes to them. How would they manage that? How would they manage sending lab specimens to us at the lab? We are coordinating and prepping with local health partners, with EMS providers, should they need to transport somebody who has Ebola. So there's right now a lot of preparatory work going on, although the risk is low. Because in the God forbid scenario that somebody slipped through the cracks and somebody did have an infection, we want to be ready to care for that person right here in Connecticut. So I'll turn it over to how the experience has been working with us and in our preparations.
Yeah, Commissioner, it's very similar. We're in this preparation mode where we want to be informed about the current situation that's happening over in the DRC, South Sudan, Uganda, to make sure that we understand what the status of transmission is occurring, what travelers we may potentially be receiving back in Connecticut. For us, that means that our core staff of public health nurses and community health workers are educating themselves, and we're discussing the scenarios of if we are assigned a person for traveler monitoring, what that means for us, what type of response it's going to require. So that's understanding the basics of what Ebola is, how it's transmitted, what exactly we need to do. And that's where the collaboration is so great with the state, is because we know that there's already some early communication about the standards of what traveler monitoring really should be in the event that a local health official or local jurisdiction is assigned a traveler that's returning from one of the affected areas. We certainly rely on some of our core training that really kind of goes back to infectious disease basics. For example, like tuberculosis. There's monitoring and follow-up of clients and exposed individuals. And there's understanding the infectious period. There's the understanding of how long a person should remain in either isolation or quarantine. And so understanding those basics, we can be prepared for if we're assigned a person for traveling, that 21-day period from their last date of potential exposure from their travel, knowing that they need to be in regular communication with a local health official so we can be on top of their status of if they are developing symptoms, whether they might need to seek health care for either suggestive symptoms of Ebola or potentially for other conditions that may be prevalent in their country of travel, and being able to respond quickly. So similar to what you said, Commissioner, it's also communicating with our partners, reaching out to our local providers to make sure they are aware of the situation reports that are available either through the State Health Department or through CDC and the World Health Organization, also knowing how to reach us if there were a potential situation where a client showed up and expressed a concern about travel history and symptoms. How do they actually notify us? How do they notify the State Health Department to access testing? And then also with other providers such as EMS. We're having very similar discussions with our local EMS providers on exactly what it means if we have a person that's under monitoring for travel history, and in the event they might need to seek health care, exactly what information they should be reviewing now so they can be prepared during the consultation process about where they should be transporting that person and exactly what precautions they should take in the event that somebody has to respond and transport that individual for health care.
And Director, Commissioner, it sounds like from both of your, what you just said, that average everyday residents don't really need to monitor their symptoms.
No, for an average resident, if you have not traveled into an area of concern, this isn't something you should have a great deal of concern about. But you should be aware of if you do get sick. And of course, there could be any number of things that you have, and getting evaluated in routine course of medical care is reasonable always. But I do think if you have been exposed to somebody who's traveled to that specific region, that might be something else to consider. But I think we also don't want to stigmatize people who are from that area of the world, because just because you're from there, if you've never even been there of recent, that certainly has no impact on what your risk would be to anybody else. And so I think that's also an important point to make, which is that just because maybe you are from the African subcontinent, that certainly has no impact whatsoever on the risk to the general Connecticut population. So I think what you're really hearing here is that the State Health Department is working closely with our local health partners to share information that we get so that they can prepare best with their constituencies and with the relevant folks should we be in that situation. But so much of public health is preparation. And a lot of times nothing happens. And that would be the ideal scenario. But we know that we're coming up on the World Cup. We have different traveling that's happening right now in the summer. And so this is a time when we like to get best prepared so that if a situation arises, we can handle it.
And that brings me to my next point. The World Cup is, of course, coming up in our neighboring states, New Jersey, Massachusetts. This will bring a lot of international travel to our area. What is the biggest concern in Connecticut, and is DPH doing anything to prepare?
So my biggest concern, honestly, is importation of measles, because we have a lot of cases right now in the United States of America, forget even international travel. But also measles outbreaks are happening internationally, and measles is a respiratory disease and one of the most highly infectious ones that we have. So again, we have a very highly vaccinated population in Connecticut. And if you've had your measles, mumps, rubella series, your vaccination series for MMR, you're 97% protected. And we've only had one case in 2025 and nothing so far in 2026, although there are thousands of cases throughout the United States. So that is my biggest concern. But as we mentioned, when you have a lot of travel and you have diseases that maybe we haven't seen in Connecticut, this is a time when we could have importation of any number of things. And that's why we have started a regular meeting cadence within our own department, among sister agencies throughout state government, and then working with local partners to help them be aware of what we're doing, again, in preparation for what could come.
And now, talking about measles, there's only been one case, thankfully, in Connecticut in the past few years. It was not in East Hartford. Why, Director, is it important for your local health department to still stay vigilant with measles?
I think the commissioner touched on a few of the key points, which is this is a highly transmissible disease. So if we have a situation where we have a case that occurs within East Hartford, for example, and it just happens to be within a group of individuals where there is either questionable vaccination histories or unvaccination status, especially as we're talking about this time of year where we have so much travel, congregate settings occurring, events around the World Cup and other things around the summertime, then that could be concerning where you may have a highly vaccinated population, but because of the current movement and interactions of individuals that normally would not be interacting with each other, if you have transmission within a group setting, then you're into a different response mode where we have to worry about tracking down individuals, informing them of their status of exposure, informing them of their risk of potential infection and potential onset of disease because of their vaccination history and susceptibility. Those are all going to be time intensive in the event that we have a case. So it's a lot of the similar preparations that we're talking about here, which is understanding transmissibility, understanding what we were talking about as far as what might be high-risk settings, and then really understanding the situations that are happening within our community. We're one of the towns with Rentschler Field that we have one of those practice matches or friendly matches that are occurring. And our local staff are already talking about a multitude of situations. There's going to be more individuals that may be staying within our hotels. There's going to be more congregate gatherings happening within just restaurants and other public places, people hosting friends and so forth, and parties and food trucks and other things that are happening at the event itself. And so there's a lot more preparation in regards to assuring that we are aware of those events or what's happening, and then exactly what the concerns might be, whether it be measles or it could be potential outbreak due to an enteric pathogen because of a large gathering where there's improperly handled or prepared foods, and the next thing you know, you have a large group of people that are experiencing similar symptoms of gastrointestinal illness. Those are things that we want to be aware of and be able to respond so we can try to limit further transmission within our community if we do happen to have an event such as measles or other infectious disease around large group gatherings.
It's great to see how much preparation is done behind the scenes before people even see an outbreak or a case here in Connecticut, and the state and local partnership that is done. Everyone seems like they're on the same page. So bird flu, or H5N1, is no longer just about birds. It has been found in cattle and raw milk across the country. Where does H5N1 stand in Connecticut today?
So last year we saw a lot of discussion on this and a lot of cases because we saw that there was transmission that occurred in the population of birds that migrate, which seemed to transmit then to cows, and then there was potential contamination of milk. And so this became something that was different than we had seen before. The good news is that in Connecticut in 2026, we actually have not really seen much in the way of bird flu or H5N1. We have been monitoring it very closely, and H5N1 tends to move with the migration of birds, which usually occurs in the spring and in the fall. And when those migratory patterns happen, you can have the migrating birds infect more of a domestic supply or domestic poultry, as an example. And so people have backyard chickens. And that's something that we've seen over the years, is that transmission of the migratory birds ends up infecting the domestic population. That is where there has been risk of potential transmission to humans. We've seen about 70 some odd cases in the United States of bird flu. And what has not been seen is human-to-human transmission. So the good news is we are monitoring it. We are tracking this very closely. We work with our Department of Agriculture, who has a lot of oversight of the milk supply. Lots of testing had been set up over the course of what happened over the last several years. But the good news is it doesn't seem to be a current threat.
That's amazing. And what is the risk of exposure to the public in Connecticut or East Hartford residents?
Well, in general, I think, as the commissioner mentioned, it's pretty low because of the current situation in the U.S. But, this is another one of those with bird flu that we're aware of the concern that residents may have when it comes to backyard flocks and potential transmission from migratory fowl. And so what we do is, specifically in East Hartford, what we've done is we've educated our residents. Mm-hmm. We know that there are some residents that have backyard flocks, and so based on the information that we have from their applications, we've actively reached out to the individuals to make sure that they have information about the risk, about what symptoms to look for in their backyard flocks, and exactly how to contact us or Department of Agriculture to discuss the symptoms that their backyard flock is experiencing and how to access testing if needed in that case. So this is where your local health officials are just trying to stay engaged and inform the public about the general risk, but also how to access your resources, namely exactly understanding what symptoms you might be looking for in your backyard flock, and then exactly how to access testing in the event that you have concerns such as animal illness or animal population die-off. And then we also just share information on the status reports. And so this is where you have the State Department of Health as well as Department of Agriculture that are sharing situation updates about the current situation of avian flu. And we amplify that information and put the message out so we know that those residents that may be monitoring it because they have backyard flocks or the few agricultural operations, small scale, that we have in our town, that they are aware of the situation and they can stay informed and know how to respond if needed.
Anything you would like to add, Commissioner, about the exposure to residents?
I think stay away from sick-looking birds and poultry, because I think that people may not think of that per se, and especially they may have respiratory symptoms like you would think of for you and me. If you see poultry that are having symptoms that appear to be respiratory in nature, you really want to stay away from those birds, even if they are your own, because I think you want to make sure you don't increase your chance of transmission to humans, although that is not as high as we would think of, let's say, flu person to person. There still is a chance that it could go from either a migratory bird or a domestic bird to you. And so I think just staying away from sick birds is important.
That makes sense. Now, dairy concerns continue with unpasteurized dairy products. What are the risks here from a public health and infectious disease standpoint?
So one thing we know in Connecticut is that we do have licensed raw milk producers, and that is something legal in Connecticut. But if you are going to consume raw milk, I would highly encourage you to go to a licensed facility, because the licensing process at least allows for steps to be in place that they must meet to reduce the risk of infection that you could get from raw milk. If you end up buying raw milk from somebody who's not licensed, they may or may not be going through those same steps that a licensed raw milk producer is going through. Now, we also do know that pasteurization is one of the greatest public health interventions, which helped reduce the risk of numerous infections that you can get from raw dairy products. So my recommendation would be to go with pasteurized products. But if you decide that you would like to purchase and consume raw milk products, I would really recommend that you do it through a licensed facility.
And Director, does East Hartford monitor this at all?
We do monitor through a multitude of angles. One is understanding some of the specific pathogens that can be transmitted through consumption of unpasteurized milk. For example, Campylobacter, sugar toxin producing E. coli. So there are some that are enteric pathogens that can cause diarrhea, abdominal cramping, fever if consumed and that product was contaminated. So we are part of the statewide surveillance network system that when a report is received and that report is investigated, they look at specific exposure history to understand where there might have been a likely potential exposure, such as consumption of raw milk or other routes for some of these pathogens, depends on which one you're talking about. So we do maintain situational awareness as we see the number of cases that are reported of specific pathogens that may be potentially from consumption of raw milk. And if we see a cluster of cases, meaning that a number of cases are reported higher than expected in a short period of time, especially as DPH is also conducting those interviews. If they notice that, then we are then notified immediately so we can then start to investigate a little bit closer and understand truly is it something such as a common source, such as consumption of raw milk, or is it something else? So it's really being part of the monitoring and surveillance of notifiable conditions that are of public health concern, such as ones that I mentioned, like Salmonella, E. coli, Campylobacter, and being able to respond that way if we have an ongoing circumstance of contaminated product that is being sold or distributed, that we can then identify the source, remove that source from public consumption so we can at least stop chain of transmission at that time, and then also work with the source or provider or distributor so we can understand exactly how the contamination occurred and how to prevent it from occurring again from a product that we know that carries some level of risk if a person chooses to consume a product like unpasteurized milk versus pasteurized.
Right. It's always so interesting to hear from community, local, state level, how seamless the collaboration is between everyone.
That's why it's so important for local health departments in the state as we work together on these, because we may see cases in one or two jurisdictions. We need the help to know what's going on the ground. And our staff may be doing that as well, but it's that case identification, the surveillance for these diseases, the list of bacteria is long, and you may see a few hits in different places, but doing this kind of case investigation to being able to get to the source is what can really save the public in the end.
I now fully understand why unpasteurized milk is not advised for pregnant women. It makes a lot of sense.
And particularly for pregnant women, listeria, which is something that, younger and older people are also at risk for, but particularly pregnant women with raw products, dairy products, is a particular risk, in addition to the long list Lawrence mentioned of bacteria already.
Yes. Wow. And so animals, of course, can spread germs through contact as well. And summertime means family trips to the zoo, to petting zoos. What makes this high risk, and what infections are we talking about?
So the animals in petting zoos, they're cute, they're adorable. They have feces just like all of us, and that can contaminate all parts of them. Their fur, their hooves, the railings, counters, everywhere that you might go in a petting zoo. And if you think about it, adults may be more cautious in the way that they interact with all those areas, but young children in particular, who can be at significant risk for things like E. coli 0157, or the sugar toxin producing E. coli, or Campylobacter, or the long list of bacteria. Children tend to put their fingers in their mouths. They may have bottles or pacifiers. They fall, they drop, they touch a railing. You're climbing over a railing. You can easily see how contaminated surfaces end up being sources of potential infection. So the main thing for families to know is that if you choose to go, just make sure that you're using really good hand hygiene so that you're washing your hands and keeping your little ones as safe as possible, because they can easily get contaminated. And the reason we educate people about this is because we've seen outbreaks in Connecticut and, of course, around the country, but we're concerned with what we investigate first. And that's what we see often. And so that's why we really want to try to encourage people to use those smart techniques to just keeping your family safe.
Makes me further appreciate. I know Connecticut and hopefully some of our listeners here go to the Big E, but when you go to their multiple petting zoos that they have staff that are specifically advising everyone, wash your hands before and after entering the petting zoos. Now, it makes me appreciate further why they have people doing that. Anything you wanted to add?
Well, yeah, and I want to add that there are mobile petting zoo operations that happen in the state as well. And so there's education that, again, your local health department is very actively involved when we hear about these events that are happening, to make sure that the host, like an organization that wants to host a small petting zoo or animal petting event, as well as those that may be attendees, there are best practices out there. As the commissioner mentioned, hand hygiene, but also we make sure that there is going to be accessible hand hygiene stations if it's going to be an outdoor event, so that way the families are encouraged to take their children and themselves over to that station, wash their hands thoroughly after contact with animals. Proper signage should be in place to prompt individuals to wash your hands. We also make sure that, as a best practice, not to have food served around the animals. So discouraging that, if we're going to have outdoor food that is served or sold around at a farm or at a mobile event, that's going to be in a separate area separated away from the animals. That way, families are not encouraged to just bring snacks or bring something like ice cream for the kids into the petting zoo area to where then it's on their hands and they're just licking their hands because of that. All of that happens. So there are certainly practices that are implemented when we hear about public events, and if a petting zoo is going to be one of those, exactly how we try to put in the control measures to minimize the risk of transmission, to ensure that the children have fun during the event, but also they reduce their risk of developing illness from some of these pathogens that the commissioner mentioned following the event.
I think that's such an important point, though, because a lot of times public health interventions are so simple.
Yes.
Think about the example he just gave, that you don't put the areas you're going to eat right next to the petting zoo. Separate it in time and space so that you can actually think to wash your hands before you go do your next activity. And such a simple intervention as that can actually make all the difference. And a lot of times that's what public health interventions are. They are those simple things that actually have the biggest impact.
Exactly. Small actions can go such a long way. And I think we repeat it in so many different aspects, but hand washing is just so important. Well, thank you, Commissioner Giuttani and Director Burnside, for leaving myself and our listeners better informed and better prepared this summer. I'm always learning so much every single episode, so thank you so much. Until next time, this is Connecticut's Health Report.
Thanks for joining us. Catch the full video on YouTube and stay connected with us on social media for the latest on health in CT. See you next episode.